Okay, Travis?
Good afternoon. Welcome to the December 15th Health and Human Service Committee meeting. This is our last meeting of the year. We're calling to order. Do we have any changes to the agenda?
Yeah, just the addition that's on your desk. The budget adjustment. Oh. Okay.
There's just a additional budget adjustment. That right there. It's just a.
And can you pull your mic down, Travis, please? Thank you. Microphone.
Okay, I got it. All right. Minutes approval. Oh, we got public comment. We do have public comment today.
No, I didn't, but I will.
We do have public comment. Let me read the rules for speaking under privilege of the floor. I agree to a 3-minute time limit. I agree not to raise my voice. I agree not to use lewd, obscene, profane, slanderous, or libelous language, or speak or act in a manner that would tend to incite a breach of peace. I agree not to speak about county personnel matters. Personnel matters include comments about the job performance of named county employees or other than elected officials. After 3 minutes, I agree to leave the microphone and yield the floor. Transferring time to another person is not permitted. I agree to be courteous and not make comments, gestures, outbursts, or other disruptions while other members of the public or legislators are speaking. I agree that if I cause a disruption and I am asked to leave, I will leave the chambers. Teresa Fulton.
Hi. I'm Vice Chair of the Human Rights Commission, and I'm just here to reiterate the need for a functioning Office of Human Rights. We have had people, I mean, you have no idea, calling, coming in, emailing, much more than we could possibly handle, and what will people do? They'll either call you or they'll be shunted off to Albany or Binghamton, and it's really, it's just a travesty. We cannot be a county without an Office of Human Rights. We just can't. So please consider that not only a director, but eventually someone to help out. I mean, handling all the people is one thing, but you know, we can't do anything for the community education-wise, things like that. So please just keep it in your thoughts while you work today.
Thank you. Anybody else? All right. Minutes approval for the November 19th meeting. We have a mover? Amanda moves. Shauna seconds. All those in favor? And that passes unanimously. We have a few appointments. 2026 reappointments, ID 13690. Do I have a mover? Shauna moves, Amanda seconds. Let's get to that. Where is, you got it? And this is for the Human Rights Commission?
No, wrong one.
The wrong one, the reappointments. All right, Health and Human Service Committee. Community Mental Health Service Board.
There you go.
Thomas Kelly, at-large representative, term expires December 31st, 2029. Mary Hutchins, at-large representative, term expires December 31st, 2029. August L. Duplan, at-large representative, term expires December 31st, 2029. Community Mental Health Service Board, Mental Health Subcommittee, Mary Hutchins, Community Mental Health Service Committee, representative, term expires December 31st, 2029. Community Mental Health Service Board, Substance Use Subcommittee, Jacob Parker Carver, community member, term expires December 31st, 2029. Community Mental Health Service Board Development Disability Subcommittee, Sally McConnell-Benet, Mental Health Service Board Representative, term expires December 31st, 2029. Sheila McNerney, Mental Health Service Board Representative, term expires December 31st, 2029. Office for the Aging Advisory Committee, Deborah Rowe, at-large member, term expires December 31st, 2028. Human Rights Commission, Nolan, Commissioner, term expires December 31st, 2028. Pei Soyinka Erwile, I hope I got that right, Commissioner, term expires December 31st, 2028. Any questions, concerns? Ready?
Yeah, I'm on the Community Mental Health Service Board, and the boards really get strengthened, and all the committees are getting fully staffed, and a lot of committed people that, not committed in a bad way, by the way, that are really focused on it, and qualified people. So,
Anybody else? All right, we ready to vote? All those in favor? All right, that passes unanimously. The second one, Advisory Board Appointments ID 13712, Human Rights Commission, Margaret Greco, Commissioner, term expires December 31st, 2028. All those,
Mover.
we need a mover. Amanda is moving. Randy seconds. Any questions? All those in favor? All right, that passes unanimously. Chair's report. I do have something for us to talk about. Corsa presented some different options for the Department of Human Rights back in August. A few weeks ago, he sent out an email about a few different options that him and his office thought would be best to move forward. And I thought that it would be great if this committee decided to take a vote today and pass on the one that we favor, so that in the new year we can get moving and address some concerns that the public has and folks from the commissioners. So, Corsa, do you want to, sorry, I know you weren't prepared for this at this moment.
Yes. Thank you.
You're welcome.
So give me 1 second, sorry. I'm to cry.
In the meantime, we're waiting for Corsa, since it's my turn to do a report.
Yes.
I definitely owe a lot of gratitude and thanks to Amanda because I learned a lot in my first year on GO about how to run a meeting. I still have questions and skip things because I get so excited and I'm ready to just roll. What Amanda's been very helpful for me over these past few years and keeping me grounded and explaining things to me. And I've really enjoyed working with you on this committee and everything that you've brought in my 4 years to the legislature. So thank you, and you will be sorely missed.
And I gave you a trophy.
You did.
So you don't have to look at mine anymore.
I'm going to take yours still.
You ready for me?
Yes, sir.
Okay, so thank you. At the last HHS meeting, a question was thrown to me: what do we do moving forward with the Office of Human Rights? So I look back at the presentation that was provided, I believe, in July or August, not in July, and discussion of the reasons why the office is vital to the organization and the community, and why it is important for us to maintain that office. After that presentation, my thought process at the time was to proceed and restore the office as is and try and get a director of human rights in to also actually evaluate what potential changes that need to be made as we go into 2026. If you remember, during the budget process, I did include in the recommended budget creating the position of, or restoring the position of education and outreach coordinator, which I was informed that it was removed from the organizational structure due to some errors also during a couple of years ago budget process. My understanding during the budget discussion was we need to move forward and fill the position of the director, and then let the director come in and evaluate what is available and how we intend moving forward with making the office a bit functional. So at the conversation, I was asked that the expectation of the committee is to provide some scenarios and some options, and for you to decide which direction you'd like to move into. So at the moment, the Human Rights Commission, the Office of Human Rights has two positions, the director and a receptionist. The position of the director has been vacant since December last year. Since December last year. And also the receptionist has been out of office over the last couple of weeks due to some personal reasons. So currently the office itself, the physical location of the office is closed. So we have transferred the phone calls to the county administration. So any call to the Office of Human Rights number is answered by Ann in my office. And also any email that comes through, and do have access to the email to identify where we will get the responses to the questions being asked in that email or in the phone call, and also ferry the calls through our internal and external systems. A couple of those calls have been transferred or communicated to the chair of the committee to identify how to handle them. I will say, I don't have the exact numbers with me, but it's been pretty quiet in terms of the number of phone calls that are coming in. I believe all of last week, we just received one single phone call, and that was a returning call from a previous couple of weeks, but we did not receive any new inquiry at all. We also do not have data in terms of the footprint when the office was open that we can speak to. So just a quick overview is that the office, as you all know, does not have any investigating powers at the moment. It's more of an education and outreach. In 2019, the charter was amended to give effect to that. And any changes, as I laid out in the document, is any changes that will remove the Director of Human Rights will require charter amendment, because the position is chartered position at this point. Some of the key things that I raised in the memo is the fact that at the moment there's no local investigations. The director position, as I indicated, is vacant, and the fiscal office is now closed. And the Human Rights Commission, as a volunteer organization, continue outreach work as was communicated by the public, the vice president, and also I have had several conversations with Pei, who is the chair of the commission, and lay out how critical and important the office is, and the number of inquiries that they have been responding to over the last couple of months as well, due to unavailability of the office as a whole. So this page here was presented to you back in June to lay out the historical context and the current challenges that face the office, which is similar to what I have indicated.
Randy?
I mean, before we get this deep into this, I had a couple questions just to understand where we are today. Okay. And to your comment that the goal was to hire a director, for them to come in and then kind of guide us to what we were going to do next. So is the job posted? I mean, what's the update on getting a person in that position? Yeah, so
as I indicated earlier, my understanding from the last conversation was move forward and fill out the position. So, and due to the budget process and also being new into the role and learning the ropes and the expectation and things that I have to deal with, the position wasn't posted early enough. This is my I accept that responsibility. So I posted the position, but because the last committee, I was asked to bring in some options that the committee can consider in moving forward with the office. I did not know if those options will include not filling the position of the director. So I told HR to suspend the advertising. Even at the point of suspension, we had 6 applicants at the time. So all those applicants has been informed that we just suspending the process and we may return to it. So currently it is suspended, and if I have clearance or clarity that we are moving forward as is, then we will have to re-advertise the position again.
Okay, I read your memo, and I appreciate it, because it was very helpful. But I guess I'm confused. I thought that we decided we were hiring a director. Maybe I must have missed that conversation. I know we talked about this, but I thought that we were moving forward with hiring somebody, so I'm...
We did talk about it, and I think there was some confusion. There were some plans offered to us, I believe in August, and then there were some questions asked, and what I had thought was going to happen was those questions would be answered, and then we would have another conversation before we move forward. So somewhere there was a communication gap, and we started moving forward before we had those questions answered. For me, this is just my opinion, it didn't make any sense to hire somebody to tell us what they should do, what we should do for their position. So if we were going to make changes, if I was new to a job, I wouldn't say, I think it's best if you get rid of me in this position and move in this direction. So to hire somebody to tell us what we should do with that office, I think is premature. I think we need to decide what we're going to do before we hire somebody and give them some charges. There's some things that I would expect them to figure out, but I think overall we need to paint the picture and what our expectations look like. And if we're not going to go the route of hiring a new director and we're going to do something different, then I think we need to figure that out before we post it. So I just think there was a communication gap. Part of it had to do with, did we combine CEDO and this position? So I think it just kind of got away from us. And then it was budget time at the same time. We wanted to ensure that the position was in the budget if we moved that direction so it was still funded. So I wanted to circle back and kind of make a decision of what direction we wanted to go into so the full legislature could vote on it.
Based on the memo that he provided and the options? Okay, all right.
Yeah.
Okay, so if I would just move quickly to, because most of this information was provided previously, so if I move quickly to the options as I indicated, so just going back to the charter responsibilities, the position is in the charter, and any amendment thereof will require regular charter amendment with including the public, it will include a local law as well as the public hearing process to amend the charter. So one of the key options that we looked at as it was included in the memo was integrate the Office of Human Rights functions into county administration. So at the moment, the Director of Human Rights report directly to the county, but we have an office downtown that is provide that front-facing element. So the model or the model A, as I presented in the memo, is just to eliminate the physical office location and also look at including or integrating that office into the county administration. If you look at the design that we presented of the future center of government, the Office of Human Rights is directly next to the county administration, which will provide that integrated face. As I mentioned earlier, I do not have the data of the number of individuals that has walked into our current office space. But based on information that I have, there's some degree of underutilization of that office space. I also don't have the lease amount, how much we're paying for that space, but I have been contacted by a couple of downtown agencies asking if we have any intention of eliminating or abrogating that specific lease, because they also feel that there's some degree of quietness in that office and they'd like to bring some degree of vibrancy back on that block, and they are interested being expressed by agencies who want to lease that office space. But based on the fact that most of the work that the office is doing now is coordinating and assisting people and connecting them with other agencies, I was the opinion that we may not need that footprint right now in the office space, and we will be, because the Human Rights Commission now have most of the activities also at the library. The library has common rooms that can be booked, and if the individual, if we hire a director with even the receptionist and we're able to provide office space at the current county administration office, they can still provide that coordination with the public and have meetings either at the conference room at the old jail or utilize the library's common rooms if they book it as much as possible. So I felt that that is something that we can do. That is within our purview, and we don't need any policy changes to be able to move forward with that. There's no significant savings with that. It's just apart from the lease that we are paying for that space and also the utilities that we are paying for that space as well. As I mentioned, the office, we have two positions, the director and also the receptionist. When I joined in January, the discussion at the point was integrating the receptionist into other county departments. If that is so desire of the committee, we can still move forward and integrate the receptionist into other functions within the county and then hire a director who, if we intend hiring the director who will, but unfortunately, if we move forward with that, that means the director will be working by themselves, and they may have to leverage resources within county administration, which is really stretched at this point, to support them in terms of evaluating what options or what additional positions may be able to create within that unit. My thought process is because the position that occupied by Mona Lisa is now moving to the city, we can still, there's some expectation and some responsibilities within the county that the position fills at the moment, and we can still continue if we have a director filled, work closer with the Community Justice Center, if I get it right, to work hand in hand in terms of integrating some of their functions and educating people on their rights, obligations, and responsibility as laid out within the charter for the position of Director of Human Rights. The other model that I looked at is converting that director position into an education and outreach coordinator. You're looking at roughly about $30,000 to $40,000 in savings if we do that. But as I mentioned, this will require a charter amendment if we want to really eliminate the position as a whole. But if there's a desire to move forward and create that position and not to fill a director position, we can move forward and create the position and fill this specific position instead of the director position, and then reevaluate our options as we move forward in 2026. And that's an option that we can explore right from the beginning by not restoring the director, but creating this position and making determination internally if at any point we want to restore the position or not.
I have a question. So in this model, if somebody wants to file a complaint or requesting assistance, we would direct them still to Binghamton? Is that how that would work?
And that's what we're doing right now. So even if you have a director, the director will not have any investigative powers.
I understand that.
So the position will still be interacting with individuals, connecting them with resources for human rights that is available, and also assisting them to fill out their forms, complaint forms, as they are doing, as we are doing right now, and also provide more of an education and outreach within the community and leverage their resources in navigating key agencies within the county that provide those services, and also work closely with the Human Rights Commission. There's some level of distance from what I have seen so far between the office and the commission, and we are looking at the possibility of a bit more integrated environment whereby the commissioners, because they are all volunteers, they can rely more on the office and helping them and meet the needs of the people, and then the commission can then be more of an advisory to the office, which at the moment they are really being boots on the ground because of the lack of the office or lack of existence of the office, and doing some of administrative functions that they really do not need to do. And I'm hoping that, so whether we fill the position of a director or convert it into education and outreach coordinator. That individual can help the commission to be more proactive and work well within the community with other partner agencies. So here on this form, I just put the module C and D together, and also, so it's more of an intake and referral with a strong commission. So basically empowering the commission to be doing more of what they're doing now by providing them the resources and the tools. The risk with that is that the commission at the moment is volunteering organization, and I don't know the degree at which they'll be able to extend the level of work they are able to do now. But this will keep a front door. So this is more what we have right now. Keep the front door, keep the office open, fill it with a director, or decide not to fill it with the director and get an education and outreach coordinator, but have a front desk, as we currently have, that people can walk in and ask for support and services, and continue to provide the legal aid support, and also connect people with the New York State Department of Human Rights in filing complaints and seeking support within the county as well. This model can also be easily co-located with county administration. So the key changes in all these models that I am presenting, or as I presented in the document, is more to do with eliminating the office if you do not want to have that physical direct space right now. But because I feel that even if we're able to hire a director, a significant amount of work that they will need to do will be in the background, and also meeting with the community agencies, working closely with the commission to really rediscover what we really want the commission to function as, and also working closely with the legislatures and identifying our key priority areas and how they want to work within the community. So in the first, I believe in the first year, there is a need of that reorganization, revamping, reevaluating the things that we do, and also identifying those community needs and working with all of us to be able to really put forward a plan of action and effectiveness for the office within the community. So there is some degree of lack of need of the direct office space right now, and getting somebody who really understands the community and working closely with the commission, identify the challenges the commission has seen. The good thing that we have is that we have a lot of commissioners that have been there for a very long time. So you get into somebody who can really work well with them, identify the challenges they're seeing, and also proposing to all of us which direction that we want to move into, or what our real expectations are in terms of this specific office. So currently, the budget, about $257,000, that's the budget that the office has, is purely payroll and very minimal administration. This includes fringe for the payroll, for the salary. So the programming expenses in this budget is about $30,000 or less. So there's not a lot of leverage in there in terms of programming. But if you compare to a place like Westchester County that have a full investigative body, Human Rights Commission, they have a budget of about $900,000. Ulster County has some degree of investigation, also limited, but they have a very strong outreach, and that is kind of similar to the structure that we did have in the county. And also, Schenectady has a co-located operational and volunteer-based, volunteer-supported agency. It is co-located within county administration, and similar to the proposal as I've laid out here, where I believe we should be looking at potentially. As I mentioned, and I will continue to indicate it, it's essential that if we want to eliminate the director, complete elimination will require some charter changes. We don't have to do that now. We can decide to not to fill it, fill education and outreach coordinator, and work our way up instead of maybe, as Travis indicated earlier, if we fill a director, is it going to be possible for the director to work its way down and say, based on what I'm seeing, I think I need to be fired because you don't need me. So it will be a difficult challenge for us to face. So it's something that we need to analyze. But I believe that whichever direction we need to go, the first 3 months will be purely trying to get the position filled and also analyze, as I mentioned, options in lease termination, and also shift the budget towards education and outreach coordinator if that's the direction we want to go in. You just also need to either determine if you want to maintain the intake, that's maintaining the office space, and also there's a need to launch a public communication plan. From what I've been informed, there are a couple of people that are not aware that we still have this office. So whichever direction we're going, it is essential that we have a robust communication plan layout and engaging with the community as much as possible and understanding what options that we will, or what services that the office can provide. The second phase, after the 3 months, you look at formalize some degree of relationship with like the legal aid, CNY Fair Housing. They are an agency that former office used to do investigation. We have communication with them, which they are willing to help us work with us in terms of fair housing investigations and things like that. So that agency is also available and willing to continue their working relationship with us. The other phase will be expand the commission's volunteer-based programming, and that will be working closely with the commission to ascertain the degree at which they can expand what they're doing, if possible, and what other changes they want to see in terms of the functionality of the office. As I indicated earlier, it is essential that we integrate any office facing with the commission and enhance their relationship. There's that gap that I have been informed did exist between the office and the commission, and I think finding a way to bring the office and the commission together more will be essential. And also, after 12 months, we will then be able to assess impact and also explore regional collaboration if possible, and probably adopt an annual outcome metric, which will help us to really measure the impact the office is having within the community and give us ability to, at least on an annual basis during the budget cycle, make determination if we are really getting value for our investment. So in terms of recommendation, the direction is if we desire to eliminate the position, then we have to start looking at the charter amendment process. And also we need to, at the moment, from what I have been informed, there's no likelihood that the MOU that we have with the state will be restored, but it's something that I did put here to us to say that we can investigate, if we like to restore investigative authority, we need to find out if that is possible, but I've been informed that that most likely is not going to be the case, but it's the state, so you never say never, it's possible. Yes. And
I don't know, it's the state.
Yes. So we also have to evaluate the most viable model that will emphasize on education, outreach, and intake. And also, as I keep mentioning this, and I'll continue to mention it again, charter amendment is essential if you want to eliminate the position. At this time, if the desire is not to fill the position, but fill a lower position like education and outreach worker, and work with them to identify areas of need and say which direction we move the office into, we can also evaluate that option and make determination around that.
Questions? Amanda?
Well, that was a lot. Thank you so much for putting that all together. I think that is a really good overview of where we're at. I'm not sure exactly what my questions are, but I do have opinions. I guess personally, I don't think we need that physical space anymore. I can't imagine that we're gonna suddenly have a lot of people in that department using that space. So I would be totally fine with, letting go of that and having whoever is in this department, with administration, although, it does need to have some sort of public access, and a way, an easy way for people to get in there. I guess my preference would be, listening to all this, I'm thinking about our Veterans Office, and that started with one person. And as the years have gone on, the director has come to us and said, here's what I need, here's what's working, here's what's not working. And I guess I would hope that that sort of thing could work with this. If we have a director, you have to find the right person, right? Like, it has to be somebody who's enthusiastic, who understands the rules and the laws and what they can and can't do, but they also have to be able to lead a department. But I feel like having one director to come back in, kind of like maybe what you were saying, Randy, and kind of look at it and try to rebuild, work with the commission. What is the commission seeing? What are they working on? How can the director utilize the commission and these volunteers to do things, and then go from there? And then, the education and outreach piece is really important, and that would certainly, I think, kind of come out of this, but I think we do need somebody who's able to look at the whole picture and be in that role and then kind of go forward. So I think that would be my preference. I'll stop. Other people have things to say.
Shauna?
I definitely think it would be ideal for us to have someone who's a real visionary and someone, I think this position is more or less a clean slate, and someone who has had the experience putting on events, successful events, who has comfort with marketing the events, is engaging with our community, I think is all going to be essential. I agree. I don't think we need to pay the rent on downtown. That's expensive, and I don't think it was really fully utilized. I will say that I think the piece that's really missing here is the community feedback. I don't think we should be making decisions right now without inviting the commissioners in. Maybe we could go to one of their meetings and have a conversation, because I think there's a lot of value in the people that have been doing this work for decades. And if we are to make this decision right now, it really doesn't include their opinions. With that said, I think it would be great if we contracted with Law New York, or CNY Fair Housing is who typically has been handling our fair housing. But if we actually made I think there needs to be a financial contribution to these agencies, because they are going to be picking up some of the counseling and the work that we've done in the past. So I think those were my comments.
Ready? And then Amanda?
Actually, I do have a few questions. Corsa, do you have space now to add somebody in your office?
No.
Is that a yes?
No, we don't. We don't have a direct space where we are right now.
Okay.
But if that is the desire, we will evaluate our options and make determination in which direction we want to go in. I have my eyes on some places, but it will require some work to determine its usability.
Okay. Does the Human Rights Commission have a home base now? Is there any? Where do they collect?
As of today, the office is closed.
Right.
Because the employee left in that space is out due to personal reasons. As I mentioned earlier, when I came into the role in January, the office was closed.
Right.
So the individual who was the receptionist was working at the county administrator's office. And getting into the summer, there was a desire to get the office space open because there were some few inquiries of getting this individual to be able to help and work with people that were going into the office. So we did send the person back to get the office space opened, and the person was working also closely with our former CEDO in terms of certain organizing the gear conference and other activities. So there's a lot that the individual was able to do to support the CEDO in that area and also work within the community. But like I said earlier, I don't have the footprint data yet to know exactly how many individuals were actually walking into that office. And
But I think you're asking about the commission.
I was.
Where does the commission meet?
the commission, I believe, meet at the library, but I don't know if they still meet. I'm not sure if they do meet in the at the office. Yes, yes.
Can you come up to the mic?
We meet either by Zoom or in the office. We have been meeting in the office, and you know, my personal opinion is I don't care where the space is, as long as there's somewhere and someone that can answer a phone, you know, but we have been meeting in the office, and when we had office hours, people were, all we did was put a sign on the door, we're going to be here Tuesday and Thursday, whatever. People were there when I got there, so there is a need for an office. I don't think where it is a huge deal, but we do meet in the office.
Yeah,
Thank you.
I agree we don't need the office space that's empty down here in State Street now. I think that's where it is. So I agree with that. I think the library could be utilized without a doubt. There's some really nice rooms there. I took a couple tours there, and I would say that, you know, a lot of the rooms had people in them. But you could reserve them, and there were some people that were actually reserving them a lot. So this may take precedent for that. And plus also, you have library staff around that could direct people to the right place, and their staff's always staffed when it's open. It's at a bus stop, so I think that would make sense for that.
Yeah. One thing that I would say is that I had a meeting with the library team a couple of days ago to evaluate the potential of having the office in the library. At the moment, they do not have an office. One of the offices upstairs that can be utilized, they don't have one. So if the desire is to use a library space, they have to repurpose one of their meeting rooms, which may require some heavy lifting because all the meeting rooms are available on the system for bookings, that individuals are able to book those offices. So if that is the desire, we will have to work with the library and make determination how that will need to be designed.
Well, there are some spaces that don't get utilized till the afternoon as well.
Yes.
So, I mean, there's a lot of space there we need more people there.
Yes.
Going there, so.
Amanda?
I think everyone is also forgetting about the Tompkins Center for History and Culture. There is in the first floor, there is a private meeting room. I don't know, it's not big, but it's not small, but that could certainly be used. I don't know that there's like an empty office or cubicle in the building, but there may be on a different floor. And then I guess I would say if we're just talking about office hours, I mean, the Scott Heyman room can be booked if it's, you know, twice a week and it's going to just be open office hours. I think that's a possibility as well. I also wanted to just say that I disagreed with something Shauna said. I guess I do personally feel like we should make this decision. I don't think that any of these options are going to be so controversial that the community is going to be really upset. I think that it's the legislature's decision about what direction we want to go. And then whoever is in the office, whether it's a director or outreach or county administration, would be the ones to work with the commission and say, what do we want this to look like? But I think this decision is up to us, not the commission.
Before I get to Veronica, she had her hand up. I want to share a few things. I definitely agree that it's our decision to make. If we were talking about closing this completely, then I would definitely feel like we need to really hear from the community. But I don't think that's the conversation. We're trying to figure out what version to move forward with. Since I came, at least for the first 3 years before the position became vacant, I think part of the conversation was, you know, we brought in a former director to do some very specific work to restabilize that office. And then the question became, well, what do we do now? We know we can't investigate. What is the purpose of that office? And I don't think it ever really got answered, hence us having this conversation today. When I look at that position in particular, I think that title is too big for somebody who has no investigative authority. So I think that whatever version we move forward with, it needs to be a title that speaks to more of what we're looking for. So the program coordinator or program education person, I think would be ideal. I do think there's a lot of value in looking at community partners like Law New York. When we talk about education around human rights, the Dorothy Cotton Institute did most of this work for many years. They were the premier human rights educator in this community. I don't know if that's something they still do, but instead of trying to kind of recreate the wheel, there may be an opportunity to support community agencies. There are community agencies in this community who do an amazing job doing community events, whether it's education, celebration. There may be an opportunity to do RFPs for them to do that versus us trying to figure out how to do that with a one-person office, and that person can coordinate and manage those bigger events. But I think if the community is involved, it makes what's going to happen easier for the community to deal with. And in some cases, it may make everything exactly what we're looking for. I know Pei had brought up, and this was part of coming back and having another conversation. I don't remember what law she cited, but she cited the ability to still investigate. And I know that Maury was going to look into it. I don't know if it ever happened, but she seemed to be pretty sure that we still had this power to investigate. Clearly, the state of New York didn't agree back then. So if we can't do that, then I think we need to make a big shift and have an office, wherever it's located, and do the education components. Veronica?
Yeah, hi, thank you. One thing, I wasn't going to say this, but Dorothy Cotton Institute, I believe, does still do human rights education. I just happened to be sitting with Laura Branca from there the other day, and she was talking about planning a new human rights education initiative for like small children. So not for us, but you know. I do think that the education is an important piece as like the role of the Office of the Human Rights. I guess I agree with Shauna that like community input is important and valuable, and like I guess I also, under the circumstances, I think it's fine to move forward with doing something other than closing the office without that, given that like it sort of seems the alternative is to just kind of do nothing new for a long time. I do really think that the having the office be like a front door, I forget how Corsa phrased it, but like a front door for community members with human rights issues to like come in and show up or call, like even if there aren't that many calls. I do think that's important and valuable. Like the fact that people look for it, even when it's not being advertised, says something. And I think it's valuable regardless of whether the office can do investigations. I feel like in some previous conversations, those two things have been tied together. Like, well, if we can't investigate, then why would we receive any complaints? But I do think that it goes a long way, like for someone who is or feels like they're being discriminated against to be able to come somewhere and talk about it and have that not received in a formal way even, but received by a human that's like, yeah, wow, I'll sit and listen to you. And like, yeah, that, I can't say whether that's officially discrimination, but I can say that that sucks, or however you want to phrase it. And one more thing. Oh, yeah, I think I kind of lost the thread of when we were talking about different locations. I agree that moving out of the current space makes financial sense. It's been underutilized for a while. But I don't know if we were talking about setting up formal office hours for just the commission. I guess maybe that wasn't on the table, but I think that as we kind of already found out, it's not sustainable to have volunteers do something like regular and public facing that we rely on. I think if we're asking someone to do that much, then we should pay them, whether that's we're hiring people or we're partnering with organizations or whatever. Like the commission's great, but there are issues with leaning too hard on people that you are not paying. That's my 5 cents.
Thank you. Amanda?
Yeah, just on that point, I totally agree. Commission is wonderful, doing wonderful things, very grateful for them, but they shouldn't be operating as their own entity. They need a staff member to be working with them, directing them, like any of our other advisory boards. That they shouldn't really just be out doing whatever they see as fit. They're accountable to the legislature and to administration, and I do worry that if they're, working with the public and they haven't been trained, we don't know what they're saying to people, we don't know, we don't know. So I would very strongly urge that we have a staff person who's coordinating with them. And yeah, I think I agree with what Travis said. Maybe it's not a director position, but it's a different title that is kind of can do that outreach education piece, but also be evaluating the whole system and what works, and kind of maybe be doing both, and seeing where the office needs to go.
So are we, to move forward in the interest of time, there seems to be A through D in terms of options. Are we ready to kind of decide what option we would like to have county administration now go down? So I guess we just go through the options and take a vote on each one. Option A would be to hire somebody, have them come in, kind of share with us over a period of time what they think should happen. Option B is the outreach, or not the outreach, but the education coordinator person, correct?
Yeah, so if you look at the option B, as I wrote it, says to convert the Director of Human Rights position to Education and Outreach Coordinator. As I mentioned, if you want to convert, that means we have to go through charter amendment, but we can decide not to convert, but create the position of Education and Outreach Coordinator to work with the community and agencies, and also maybe come out with a plan of action for next year in the close relationship with the commission for us to make determination which next steps we'll take towards the 2026 budget. If we have to, the desire will be at that point to restore the position or to do the charter amendment to fully eliminate the director position.
Definitely.
And then C and D were just kind of to rely on the office to do most of the work. So are there any of y'all who would like to vote for option A? Are people interested in option B, which is what Corsa just explained?
Yeah.
You could raise, that'd be easier.
I think that's the one.
So it seems like the four of us, which would be unanimous. Whoop.
I would say just amend the language in the option B instead of convert, by just to say create the position.
So it seems like option B is what we would like to pursue with that language change come January. All right? Amanda.
And then just to reiterate, so going in that direction, getting rid of the space, the physical space, and then a year from now, kind of evaluating like, do we need a director? Do we not need a director? And you all can decide, should we amend the charter, or should we do need a director and let's hire that person? Okay.
Comment, Travis?
Yes, ma'am.
So the other part of that was D, which was strengthen and leverage the Human Rights Commission community partnership, which you guys talked about, Law in New York and those kinds of things. So maybe it's the director or this new position that would look at that, but I'm thinking we might want to have Corsa looking at that as well.
Absolutely.
So I think that makes a
Absolutely.
lot of sense to me.
Yes. Yeah. All right. Well, I don't have anything else in my report, so now it's your turn. Go.
I'm sorry, I just have one question. So, Corsa, you would go ahead and move forward with putting a job title together for the education and outreach?
Yeah, so we do have it's an existing county position. We just have to review it. And I will check, it's unfunded in 2026. So if you look at the resolution that was passed last month, eliminating all unfunded positions. So assumption is that this position will be eliminated in January. So if that's the direction you want to go, you have to make a motion tomorrow to create that position. I'll write the motion for you. I'll write the motion and send it to you, and it has to create, working with HR to create a position of education and outreach coordinator and be funded with the 2026 funding in the budget for the Office of Human Rights.
So it would actually be a net gain, though, since there's a difference in salary?
It will be a net gain,
Okay.
yes.
Okay.
See,
So
Veronica,
I'll send so you can make the motion from here to go to the full committee, then I'll send it to Taylor to be included in the agenda for tomorrow. Then we can hire the position. We can advertise and hire in January.
I get that. I just wonder if, that would end up being quite a lot of discussion tomorrow night at the meeting for all the legislators who weren't here and would need to they might have questions, want to say why, So we can certainly do that, but you may want to say, let's talk to folks over the next 2 weeks and, put this on an agenda in January, I think.
Yes, sir.
If we did that, which I'm fine with, I think that's a good idea, would that affect that position coming off the book? So it's unfunded right now, and we're going to take any things off the book? So
No, nothing is happening in the books. So my direction from here, what I'm hearing is not to proceed and repost the position, leave it as unposted, and then create the position of the coordinator through the approval from the legislatures and seek to hire in January or in February. Yeah.
that sounds good.
I think you may want to say, this committee strongly suggests that this is the model we want to go with. We can explain it to you all, people will have questions, but as a more this is the direction we're going, we don't want everybody to come up with their new ideas and,
Right.
Yeah.
No, that makes sense.
Veronica's got her hand up.
Oh, yeah, Veronica.
Veronica?
Yeah, just from my understanding, is this the idea that this position, who would this position report to? I think right now,
County
In the-
administration.
Yeah.
okay. So that would be different than how it is on the books now anyway, right? Maybe?
Well, this position doesn't exist in this way on the books. Are you talking about the director?
I'm talking about the education and outreach coordinator position that y'all are talking about trying to hire, because I thought the previous idea was that was in the Office of Human Rights and reporting to the director, but obviously that doesn't work without a director.
Yeah, the idea isn't for them to report to the director. We wouldn't be hiring both.
So if I may
Wait, so
help, so if I may help, every single position in the county directly or indirectly report to the county administrator. So if you don't have a supervisor, you report to the next person in line. So if the director position is not filled and the office exists and we have staff, they report directly to county administration. So if you fill this position, the person will directly report to county administration or individual that we will assign them to be reporting to.
Okay, right, that makes sense. Thanks.
This is none of my business, but I mean, you could assign one of your deputies to work very closely with this person and be there, yeah.
Or I can beg Maury to do that for me.
Or Maury.
All right. So it sounds like we are done with this, and now we will go to the county administrator's report.
Yeah. So I have a resolution on the tables on the pack, in the pack. So if you would like to move the resolution.
Yes. American Rescue Plan Act, ARPA funding reallocation, ID 13760. Amanda moves. Shauna seconds.
Okay, thank you. So a project that the funding was allocated to in 2024, I believe, we did not utilize all the funding, so we have a bit over 400,000 available, and because of the provision that exists with the ARPA, we cannot assign it to a new contract, so we have to assign it to a contract that was executed in 2024. So we are using that. So this resolution is authorizing us to use those funding to pay some of the expenditures that the local dollars were used. So in effect, this money will just come back to the county and to reduce our burden, really.
Shauna?
What was this funding initially allocated for?
Let me see here. I believe it was a couple of projects at the highway department that we got some additional funding that pays for that. So the funding wasn't fully utilized for that specific project. We got state grants to cover that aspect.
Gotcha. I'm sorry, I didn't read it.
Yeah. So it's not the other one you were thinking. We haven't touched that one yet. I know where exactly you are.
Other questions for Corsi?
The county administrator can read minds.
Magic.
No other questions? All right, we ready to vote? Ready?
Yeah, thank you for this. The math, I'm trying to understand the math, but I'll ask you at a separate time because it doesn't add up. So must be some money was put someplace else, or and maybe there's more money available somewhere. But at another time, you can explain it to me.
Okay.
I know it's ARPA, so.
Yes.
Okay.
All right, are we ready to vote? All those in favor? That's unanimous. Corsi, do you have anything else?
No, that's it. Thank you very much. I think it's been wonderful working with all of you on this committee. I don't want to say it's the premier committee, I don't want to be in trouble, but it's a wonderful committee, and I'm very happy with what we've done together this year, and looking forward to 2026.
Awesome, thank you. And keep things moving and roll right over to the Department of Social Services. Where'd she go?
She just stepped out for a second.
All right, we're going to not do that. We're going to go to the right, to Jenny at Whole Health Department.
Great. I feel like you guys are revealing to my team how unglamorous the job of department head is at these meetings. So I have a couple of updates. I think in your packet, you received our data impact report. This is actually, I sort of just wanted to share this. This is some data from 2024. As you all know, there's a data lag. So I think we're, we're hoping to produce this also for 2025. But I thought since it is our December meeting, it would be a good time to just highlight some of this. So and assuming that these numbers were the same for this past year. So within 2024, we had 300 social media posts, 70 community events attended. In environmental health, they conducted 924 food establishment inspections. They vaccinated 579 animals for rabies, and they did 131 public water supply inspections. For immunizations, 233 child immunizations given, 347 adult immunizations given. For our mental health services, we had 217 clients who received personalized recovery services in our PROS program, 511 youth that received mental health support, and just shy of 30,000 mental health clinic appointments overall. And then in our family and child health realm, we had, about 1,300 women, infant, and children in the WIC program, a nutrition program. We supported 132 pregnant people through pregnancy and postpartum, and 415 children birth to 5 received developmental support. So I just wanted to sort of pass along this one pager and read those numbers into the record, because it's a good wrap up of the work that we do.
It absolutely is.
The other thing that I wanted to share before I pass off actually to a couple folks on my team is that on the public health side, we have kicked off a little bit of a realignment discussion of how some of our programs are internally organized. We are not looking deeply, we're not really looking at like what we provide, but rather how we're situated internally to provide those things. We have brought in a couple of consultants who are helping us with this process. They've been having several meetings with our division directors over the last month, and we had a staff participation or a staff facilitated discussion last week. And so the intent here is that this really is a participatory process with all staff involved, providing on the public health side, sort of providing their input into the way that we are structured internally. And again, we're really looking at how programs are grouped together for impact, for data, for efficiency, and things like that. So there'll be more to come on that next year. I just sort of wanted to share that we have launched this initiative. And then I believe that you guys had asked for an update on our Public Health Fellows program. And so I'm going to give you a quick overview, and then I'm going to hand briefly to 2 of our fellows. I thought who better to give the update than our fellows themselves. So the Public Health Fellows program was launched in 2021 to strengthen public health capacity in response to COVID. The fellows are actually New York State employees that are placed in local health departments in full-time roles. We have had over the past, since 2021, we've had 11 fellows at Tompkins County Whole Health. We've been really lucky. Several of those have gone on to join us as full-time staff members. Several have gone on to have other roles in the community, also working in public health or healthcare. And they have all really contributed to high impact initiatives like the community health assessment, environmental health, oral health equity. They're really embedded in department teams, and they play a key role in advancing our work. I'm going to hand it off to 2 of my fellows to sort of briefly just give you a couple bullet points on the work that they do. Go ahead, Anushka. You want to introduce yourself and kind of lean on into
Hi. Yeah, of course. Hi.
About 3 to 4 inches away.
Okay, thank you. Well, thank you for having me here. I'm Anushka. I'm a public health fellow here at Tompkins County Whole Health. So a little bit about my background is that I'm a dentist. I did my undergraduate dental degree from India, and then I went ahead and got my master's in public health from Cornell University, and then later on took on this role as a public health fellow and was placed in Tompkins County. So I essentially work on the community health assessment and improvement process, which is called the CHA and the CHIP. To preface you what CHA and CHIP exactly is before diving into my role. So the community health assessment, or the CHA, it identifies the community's key health needs, inequities, and underlying social drivers using data and community input. And then the CHIP, or the Community Health Improvement Plan, it translates those findings and into shared priorities, measurable goals, and coordinated actions led by community partners. So my roles and responsibility entails supporting the CHI Tompkins process. That's what we call it. It's the community health improvement process through population health data integration and analysis, aligning local priorities with New York State prevention agenda. The prevention agenda is like a framework which consists of 5 social determinants of health and has 24, is broken down into 24 health priorities that basically drive health. Then synthesize community health survey results with federal and state public health surveillance data, as well as qualitative data to identify priority needs and inequities. So in the month of March earlier this year, we had a community health survey disseminated countywide. We got around like 1,800 responses from the residents of Tompkins County, and then we integrated that data into lots of other databases. We gained some qualitative input through interviews with the residents, and that's how we did all the data triangulation. And now we have this beautiful, super long community health assessment, which is almost done and is set to roll out, like submit to the New York State Department of Health, hopefully by next week. So yeah, that my position also includes prepare this clear public facing reports and required submissions to New York State Department of Health. I also facilitate cross-sector discussions with 20+ community partners to support shared priorities. So this process involves a lot of stakeholders. We created a partner survey as well to understand what the community organizations are currently working on, what their goals are, what their mission is, and then integrate their work into the plan as well. And then support development of the community health improvement process using all of that data and translate those assessment findings into measurable objectives and interventions. So the interventions that we design are basically measures that we kind of track over the 5-year cycle. So the New York State Prevention Agenda is for 2025 to 2030. So there will be continuous quality improvement indicators that we will essentially track from starting this year to the year 2030. So the impact of this position is to deliver a community-informed, equity-centered foundation for priority setting and resource alignment that positions Tompkins County to advance measurable health improvement through 2030. Thank you. Are there any questions?
Any questions? No?
Awesome. Thank you.
Thank you.
Looking forward to seeing all the reports, though. I'm looking forward to seeing your final reports. That's great.
Yeah. Thank you.
Yeah, she does great work. Hi, everyone. I'm Allison. I am the Public Health Fellow. Well, I have the pleasure to be the Public Health Fellow with the Drinking Water team of the Environmental Health Division. In this program, we monitor approximately 160 water systems across the county, and those range in size from a large municipal, like the city of Ithaca, to a small 5-unit apartment complex that's on its own well. And as a part of this team, I serve as a point of contact for water operators and owners alongside our other team members, and I help respond to compliance questions and support operators in understanding requirements, which can vary widely depending on the system type and sampling history. And a major part of my role involves reviewing incoming water samples to confirm that they were collected correctly at the right time, location, and using the proper method. And I assess these results to determine whether any follow-up is needed. And it's actually kind of an exciting and challenging time for drinking water right now because there have been substantial new federal regulations that have been a challenge for a lot of our systems to get ready for and a pretty big lift. So we have 58 federally regulated water systems that these regulations apply to, and these include updated lead and new PFAS regulations. So I assist these systems in meeting the new regs that are currently in effect, as well as preparing for upcoming compliance dates. And I've also assisted in response to 2 action level exceedances that have occurred in our county since these regulations took place. This year also brought new changes in regulations with annual water quality reports, which is a yearly requirement for our 47 federal quality systems. And I've assisted in reviewing each report, providing assistance in updating them, and verifying that everything's accurate. So beyond regulatory work, I've also been involved in field response and addressing consumer complaints. And one example of this is we've had situations that have encountered an emergency response, including 30 boil water events that have occurred in 2025. I also participate in field surveillance sampling, which are at least annual spot checks of all our systems. And so for overall, I believe that my impact here has been helping to ensure safe drinking water in our public water systems through proactive monitoring, trusted operator relationships, and guidance on evolving regulatory changes. So if anyone has any questions, I'd love to talk water.
Questions? Annie needs to be here.
Yeah, right. Can I just thank you both. Particularly to the water, I serve on the Water Resources Council.
Oh,
and
awesome.
That, you know, we're always talking about these issues. It's an advisory board, but I mean, without water, we don't have life, right?
Right, yeah.
So thank you for all this good
Yeah,
work.
it's been a great opportunity to be able to work on this, yeah.
All right, thank you.
We have one other fellow who couldn't join us today, and you'll see sort of her notes on the third page of the handout. She's been working on oral health, particularly focused on pediatric dental access in the community.
Awesome.
So they have been a tremendous asset to us, and you know, we are hoping to see the New York State program continue. And if it doesn't, I will be back here, you know, looking for other pots of funds. So thank you all so much.
Absolutely.
Actually, I do have a question on dental. I think it's my understanding that all the schools are providing free dental now for cleanings and inspection. Is that true, or?
I have not heard that, but I don't want to say that that's not true.
Okay, I just
But
think
I could find out more and let you know.
it's really important for young people for their teeth, and so that when they get older, they don't have issues.
Yes, we
so I
are
was
in
just-
the early stages of trying to come up with a model that would really expand pediatric dental access in the schools. And so I can guarantee you that you will hear more from me on this in 2026.
Thank you.
Awesome. All right, we are going to move over to Kofa and Lisa Monroe, who couldn't be here because she's not feeling well. Huh? Well, Brittany, I'm gonna come back to Brittany.
Okay, sorry. I'm overstepping.
I'll stay in my office where I don't spread germs. How about that? I don't really have anything on the agenda. Just wanted to say that we just are wrapping up, end of year things. We're beginning to kind of clean house over here, try to start packing. It's going to be a big job for us to do. And we made it through our Medicare open enrollment, so that was a great thing. We were able to serve 620 people with health insurance counseling during that time with the 3 staff we have here, and also the volunteers that we contract with Lifelong that does their they do a few days a year. I can't remember what the sessions are called, but they're just sessions that they do. So yeah, 620 people came through in that time. So that was it was a heavy lift this year. So that's all I have to report.
Awesome. Anybody have any questions for Lisa? All right, thank you, Lisa. Feel better?
Thank you.
All right, now we're going to move over to Brittany from the Department of Social Services. I did forget to mention that we do have one topic for exec session, and we won't resume afterwards. Brittany.
Hello.
Hello.
So we have VOA here with us, and I'm wondering, they're under me on the agenda, but can we move them before me?
Yeah, absolutely.
Okay.
Yeah.
You, Lisa.
Hi, my name is Lisa Barrett. I'm the Ithaca Housing and Shelter Services Director for VOA, currently over at Cherry Street.
And hello, everyone. My name's Jay. I'm the Program Manager for Code Blue this year.
So we were asked to attend to answer any questions you guys may still have lingering or be of a service however we can. So I have some business cards if you guys have questions like go after this, but yeah, we were asked to come to answer any questions you guys may have.
Well, we're really excited to have you all as the new providers and the managers of the shelter. Is there any questions for Amanda?
Thank you. I had a tour and really appreciate all the work you guys are doing. We've talked here, and I think we asked the day that Randy and I were there about folks who might have a pet. And I'm just wondering, in the past couple of weeks since you've been open, have you had anybody coming in with pets?
So we currently actually have one gentleman who has the most perfect puppy.
Okay.
Several of my employees use their lunch break to go buy treats for the dog. Her name is Izzy. She's a Aussie mix, beyond well behaved. For this gentleman, because we have a young lady in the overflow space that we originally designated for pets. This young lady is living with paranoid schizophrenia, so we didn't think that putting an animal in direct contact with her would be the safest for both her and the pet. So we turned the mid-office, the intake office, into basically a room for this gentleman and his puppy.
That's awesome.
That's wonderful.
We had another gentleman call who had 2 dogs. We spoke a little bit about this morning in the meeting I attended. My concern for that was one person with 2 animals might be a little excessive, and also we may not be able to help somebody else if we have one person with 2 dogs. What this gentleman was told was that he was more than welcome to bring the dogs by. As explained during the tours, if a flea infestation would shut Code Blue down for a minimum of 6 days, making all of these people not being able to be there. So we told him he's welcome to stop by, let myself or my program manager, meet the dogs, ensure that they were at least well taken care of as far as bodily and fleas, and then we would try to accommodate, because we're told they're small dogs, so in my head, if they're like a Chihuahua, like 2 Chihuahuas, we can accommodate that, but if we're talking, a German Shepherd is a small dog, then I may have some other questions. But the gentleman to date has not stopped by.
Thank you.
Yeah, I just want to say, you all have been a breath of fresh air, and just from the tour where you opened the place up, where you answered all of our questions, even hearing feedback from people that are staying there, the tone of the shelter workers, even the security, has been really positive for people that are staying there, and that's something, in the 8 years that I've been a legislator, I've never heard positive feedback about our shelter. So I really want to acknowledge that, because that makes us feel good. And that also, we're definitely moving the needle and changing the culture. And that's something that's been our goal this whole time. So thank you.
Thank you. That means a lot coming from you guys. This would be the 5th program that I've built from the ground up. I've been a social worker for 16 years, and every time I'm like, okay, I'll have better workplace boundaries. Yeah, that's a damn lie. He sends me home half the time. I have to remind him I'm your boss, and he's like, I don't care. You've been here for 12 hours. Go home. But it is my baby. My security officers are phenomenal. We shared during the tour that they are armed, but you would never know it. We had a gentleman who was incredibly intoxicated the other day, and my security guard handled it with complete professionality, was able to make sure that both myself, because I was the target of his intoxication, both myself and this individual were safe. So we were very grateful for his expertise in that moment.
Randy.
Yeah, thank you. Good to see you again. How is the building itself going? Is there anything that you are concerned about as far as the facilities, or?
So we've had a couple leaks, but it's to be expected in a building that old. However, Libin and Urel and Libin and their team are they're phenomenal. We couldn't ask for better support from the county for that on that front.
Great. And of course, Christmas is coming, and I'm sure you're going to have people in the shelter then. Can you take donations easily of foods, or what do you suggest?
So we, No More Tears is actually offered to cater Christmas dinner. They catered Thanksgiving dinner. I am Mrs. Christmas. He's called me that for years. We have a tree, we have decorations. We've had multiple donations to where we're going to make sure that everyone wakes up to a present on Christmas morning. So we have stockings. It's nothing great, but it's like a granola bar, some socks. Everyone who is in shelter will wake up to Christmas morning. My staff plan on making Christmas morning breakfast. I think we ordered scrambled eggs, sausage, and they're gonna make French toast. So everyone has a Christmas morning.
Great. That's awesome.
Thank you.
Any other questions? Well, thank you. You guys are off to a great start. We're really impressed, and we really It's a fresh breath air. Thank you.
I will leave my cards with Brittany if anyone has anything else. We're going to get back to the shelter just to make sure things are smooth for the evening.
A question, donations, blankets, clothes, things of that nature, is there a time, do you accept anything?
We accept everything and anything. Our protocol is if it's coming in its original package, we can take it right back to our internal storage. If it's something that's been used, obviously it's welcomed. We just run it through, we follow bed bug protocol, even if it's coming from somebody we would know and trust, just to maintain protocol. It's run through the dryer on high for 20 minutes before it's put back with everything else.
People can stop by any hours as long as you're open?
Yes, I'm 24 hours staffed. There is some form of management on every shift.
Okay.
Excuse me. And then my evening and overnight security guards are a little more zealous about making sure you are when you're coming in when the hours are dark. But during business hours, I'm generally there, so I would recognize most people that would come in to donate. I do encourage that people just call and let me know that they're on their way. The other day, we kind of had a traffic jam. I had OAR, Reach, and Alexis Aubrey show up all the same time. And I'm like, okay, love you all, but there's 20 of you in my doorway. Can we move? So just a call so we can make sure that we're staggering properly and that the residents have some form of privacy within their home.
I wanted to give a quick shout out to the Park Foundation. Some folks at our staff had reached out to them to try to understand if there was any donations that can be given for some of the beautification efforts. And Park Foundation came through with a small grant and used a small fundraising opportunity to give some money that they, I believe, dropped off to VOA. So I just wanted them to also get a little bit of props too.
Absolutely. Park Foundation has been great over the years.
They were wonderful. They brought us a check last week and I dropped it off to Rob on Friday.
Wow.
Nice. Well, thank you for coming to share your time with us.
Thank you.
Thank you.
Of course.
Okay. So in your handouts, there were the THA shelter analyses for adult individuals and families. So I'm going to preface this by saying I'm not going to, for brevity of time, I'm not going to focus on the families one. That being said, the reason is that we receive a allocation through OTDA for family-centered case management, which covers the full cost of our senior caseworker right now. It ends every June and then restarts in July, and then the state has decided it should continue moving forward. So as of right now, we still have that. I feel like the numbers for families could be a little off with this grant or this allocation being in place. So I'm not going to focus on that one. So in looking at the THA shelter, and this is if we're looking at our THA shelter and hotels, and the average length of stay for individuals who are receiving THA is 81 days, or just shy sort of 3 months. The data on the sheet looked at 9 months worth of data from January 2025 through the end of September. And if we're looking at the cost right now for a senior caseworker, for the local cost for a senior caseworker working with adult individuals at our THA shelter, and it's roughly $54,000. So we were looking at that number based on if we decrease the length of stay for individuals and get them into housing sooner, which would be with the help of a caseworker, what that savings would look like. So a thing to note here is that we don't provide case management to individuals who are staying in hotels. However, if an individual who is working with a caseworker in the THA shelter successfully gets into housing, then we can move somebody out of hotel into shelter if there's an opening, and that person qualifies for placement there. So in looking at this paper, the numbers here, it's important to note that the local share cost for a senior caseworker, if we decrease the stay from the average of 80 days down to 70 days for an individual, it results in a cost decrease of roughly $63,000. So that cost decrease is greater than the cost of the local share for a senior caseworker. So having a caseworker work with an individual in shelter to successfully get them into housing does present a cost savings for the county. And as it continues to decrease in length, or as the length of stay actually decreases, so if we go from 80 down to 70 down to 60, the cost savings for the county at local share increases. Now, the reason I'm focusing really here on the numbers for the THA shelter and hotels, rather than just looking at the numbers, which is the second box for just the THA shelter, is that they work together. So individuals who are in hotels, if the shelter's full, that's part of the reason why they get placed in a hotel. And if we get someone out of shelter, we can get someone from hotel into shelter. So I think looking at both of them together is important. If we're just looking at THA shelter, we would have to decrease the length of stay by 20 days for that cost savings to be better for the county. However, I would say we're still going to be looking at a hotel placement, so using that as a factor is important. Some things to, I think, consider here when we're thinking about this is that when we move someone out of shelter and into housing successfully, that room is then empty. And when a room is empty, if we don't have someone to immediately move into the room, we pay full price for the room. We don't get reimbursement for that. So right now we get roughly 29% reimbursement for adult individuals. Now, I will say that our THA shelter is pretty full all the time. And when someone moves out of shelter into housing, we move someone out of a hotel into shelter. So currently, I would say that would continue to happen. However, if you're thinking about it in that manner, it's like if we move someone out, you got to move someone in, and that's kind of how it would continue to happen. Now, if we're looking at the HUD changes that are coming, there could be more individuals seeking shelter in the near future, individuals and families. And then another thing to consider is just lack of affordable housing and the amount of housing that we need for individuals in shelter. So all of these kind of factor into these numbers not being a perfect science. They're estimates based on like best case and based on the number of individuals currently at Roadway and other hotels, which is 67 clients. So everything's really based off that. And if you have questions, I'm happy to answer.
Britt, if we were in a different shelter situation, then those numbers would change even more, correct? So if we weren't having to pay for a space, if we just had spaces and we weren't paying for individual rooms each night, then the savings would be even greater.
So currently the numbers are based on our average per diem rate. So it will change when THA, if we get the shelter certificate, the numbers change. And yes, it changes based on the THA shelter versus the hotel versus if we had a shelter somewhere else. So again, these are very specific to Roadway and other hotels.
Gotcha. Russell, what do you think about the numbers?
I think we've talked about this, myself and the team, and I think these are realities that we face, and I think it ties into our conversation about even the roadway agreement discussion, the Cherry Street discussion and having case management on site, and it helps in cost management and really getting people into housing. And I think the family centers caseworker prove that it works if you have case management in place and working with these individuals from day one. So depending on which direction that we go, I think fundamentally we're looking at expanding our work with external agency and helping manage our shelter placement all together for us. And each of these processes will involve a case management and caseworker intervention as well. So yes, this basically shows where we are and where we can identify cost savings if we are making the right decisions at every point in time.
Jonah?
Can I add
Oh, yeah,
something?
sure.
And then for adults right now, we've moved, not we, our adult individual caseworker has helped move 12 adults into housing. And when we're looking at families or adults, we still need to track that long-term outcome. So these families were moved into housing within the last 7-ish months. So looking at the long-term of like how are they stabilizing in their homes, important to know whether they're successful when they get placed. And then also for the families and for our adult caseworker, they are still continuing to provide some services after individuals move into housing. So that for a period of time after. So that piece is really important because if they've moved into housing without any further case management, they're more likely to not be successful.
Sure.
Can you tell us what the average wait list is for a family that is applying for Section 8? Do you happen to
Don't know that.
Okay.
I can get that info. Cindy's on, so I don't know if she's got Liddy in the office who probably would have a better.
Sure.
I know that the Section 8 wait list is very long.
Yeah.
I know somebody that's been waiting for a year and a half.
Yeah, it's frozen.
Yeah.
Cindy did pop. I don't know if she has.
Hey, Cindy.
I do not know the answer. I do not know the answer either, but we will do our best to find it for you.
Great.
Oh, wait, Liddy may have just chatted me. I'll be back.
Okay, thanks.
Do we know, and maybe this is a conversation to have at HED next month, but do we have an understanding of the type of housing that's coming online over the next few years? Not projects that people are talking about, but things that are actually being built now. I know some of them are specific to folks that we might be referring to. But do we have any sort of inventory of what we expect to have come online over the next 18 months?
I can get that information for you. I don't have it on the top of my head or like compiled all together.
All right, thank you. Randy.
Brittany, I just want to thank you for showing this kind of data because I haven't seen this before in the 4 years I've been on here, and it's good to see kind of the semantics of things, and you don't know what you don't know, so I appreciate it.
Well, thank you. I can't take credit for it. I didn't pull it, so my staff did, and I wish they could be here to answer more questions that if you guys had for that, they're not. But if there are questions I can't answer, I can bring it back to them.
No, but the data is important. Like Randy said, being able to look at these numbers, to be able to understand for us, where do we make the investment? Do we keep spending money on putting people in shelter, or do we spend this money to reduce the time people have to spend in the shelter? And for folks that are fiscally conservative, we can demonstrate that this actually is a savings over time, and it could be much more than what it looks like now. Once somebody gets there and we're able to do these things and these other apartments come online and so on and so forth, making financial decisions for us is based on so many different factors, but actually having these numbers that say, oh, wait a second, if we spend $53,000 here, we're going to save at the minimum $30,000, $40,000, and then we're going to get people into better situations. Perhaps we might save $120,000, but at the very least, this pays for itself and more. I think that's really important. So thank you for getting those numbers together so fast.
Absolutely. Adele has.
Adele.
Hi, I just wanted to add, most of the families that our caseworkers were able to move into housing either had waiver money or grant-funded programs, so RSP money or STEP monies that our agency also handles. So that was how most of the families were able to get into housing. I want to add one other shout out to our adult case manager. She came on board with us end of July, beginning of August. So the 12 folks she has assisted with moving into housing has been in that relatively short amount of time frame. So I just wanted to add add that impact in there as well.
Thank you.
I will also add, I know you've all met Barb, some of the families that moved into housing struggled in the sense they hadn't been in an apartment before and just navigating landlords and school bus routes and all that kind of stuff. So the follow-up that she's been able to do with those folks to support them on those basic life things has been huge, and them seeing themselves as deserving of being in an apartment, quite frankly, because folks have told her that. So the follow-up is beyond critical of, especially with families, but also with adults. So I just wanted to add that as well.
Thank you for sharing that, Adele. I didn't even know that that was part of the program, that once they got in, you continued to do that work with them. To be frank, that's many of the problems that we've seen at Asteri in our house was people get in, there isn't this aftercare, like a real aftercare management, and folks flounder and become unsuccessful, and then we know what happens at that point in time. So I'm really excited to hear that that's part of the program is that aftercare. So thank you for sharing that. Shawna, you had something?
Yeah, I just want to add, I know that there is a new SRO that was opening up on Route 13, and my guess is they are going to open up within the year. My concern is that they built this business model on HUD housing and receiving subsidy for that. And I guess I'm concerned if they're going to change some of the waiver process for people with substance use and mental health struggles. And wanted to see if we might be able to reach out to them because, you know, I would assume at this point that they're probably trying to figure things out and they might have some openings.
Yeah, I think that's something I need to connect with Liddy about.
Okay, great.
And the COC and.
Sure, thank you.
With that group, yeah.
Cool. Any other questions for Brittany? All right, do you have anything else, Brittany? All right, thank you. Back to the screen. Kate Shanks Booth from Youth Bureau, County Youth Bureau.
Hello, how are you guys doing? Good afternoon. Not a whole lot to report. We are in the second phase. We had 11 interviews for our youth service specialist. We brought 3 individuals back for a second interview. We have the last one scheduled on Thursday, and so hopefully this week we will have a decision and be bringing a new staff member on board right after the first of the year. So that's really exciting. Hopefully, fingers crossed, all positive things that way. We're wrapping up the end of the year. Information. Teresa's working hard on that with our community partners. And also we are planning to do some community cafes in the first 3 months of the year. We've started conversations with our youth commissions and our community councils to use them, really rely on them to help us pick a date, get the word out, and have community feedback from the communities and the municipalities as we're getting ready to launch our next RFP in the spring of 26. So more to come.
Thank you. Questions for Kate? No? All right, Kate, thank you.
Thank you.
Enjoy your holidays.
You guys too.
I will go to JR for Veterans Affairs.
Hi. Good afternoon, everybody.
Good afternoon.
Happy holidays. All right. Thank you. I just have a few things I just want to report on. This weekend, actually on Saturday the 13th, was Wreaths Across America. This is something that's celebrated across the nation where wreaths are placed on the graves of veterans. It's at local cemeteries. Normally our regional observances are in the national cemeteries in Bath and Elmira, and also at New York State Veterans Cemetery in Romulus, also formerly known as Sampson. But this year, Tompkins County has joined the numbers of communities who are observing Wreaths Across America. I was honored to attend the inaugural celebration of Newfield. They hosted one at their Woodlawn Cemetery, and after the ceremony, they fanned out, putting wreaths in both the graves at Woodlawn Cemetery and at Trumbull's Corners. And they had a guest speaker who was United States Army Brigadier General Gary Yapel, who's also a Newfield resident. And he came and spoke to the meaning of the program as well as the impact of having grown up in Newfield and his experiences being deployed in Afghanistan. That was really a fitting and emotional tribute that he provided. And then all of us joined in, grabbing wreaths and just, like I said, fanning out and putting wreaths at each one of the graves. And the one thing that we were asked to do was to make sure that when we put the wreaths down, that we also spoke the name aloud of the veteran there. And the reason for that is there's the belief that they say that when you die twice. Once when you die and you're put in the ground, second when no one remembers your name. So this is something to make sure that our veterans are not forgotten. And the quote that they use is, "Remember the fallen, honor those who serve, teach our children the value of freedom." That afternoon, we had our third annual Army-Navy football game watch party. We had about 40 plus people come through, mostly veterans with some of their families. We took over long shots up at Trip Hammer Marketplace, and I do mean literally took it over. There were some people who came in and there was nowhere to go because we had everybody in there. We had all the seats. But that was actually a good thing. One of the things that was pretty neat about it was, in addition to coming there and being able to cheer on your favorite team, go Navy, also people were able to find out information that was offered by our Department of Veteran Services, as well as the clerk's office in DMV, through the presence of Dennis Grover, who came, DMV loaned him to us for the afternoon. I told you, I believe, last month in my report about Operation Warm Hands. This is an initiative that our VSO, Veteran Service Officer, Ignacio Lopez, started up, basically to collect basic needs that we could fashion into gifts or gift kits to be given out to veterans who are either homeless, impacted by natural or other disasters, or just simply in need of some basic items. I want to say a huge thanks goes out to the community because we've got enough to, we think, roughly assemble 250 kits that'll be getting taken care of in the next couple of weeks and sent out to various places. Some really cool news I just got this morning, late this morning. You hear me talk about the New York State Joseph P. Dwyer Peer Support Grant and Peer Support Program. And that is a grant that allows me to offer a lot of events and opportunities for veterans across our county. Well, this past year, they changed into a national organization. They're no longer just the New York State Coalition. And the director sent me a link this morning, letting me know that Tompkins County is featured in their weekly update called From the Front Lines. So I'll be sharing that YouTube link with you later today.
That's awesome.
And lastly, since we're in this season of giving, I do want to say thank you to our administration as well as to all of you for your support of my office, particularly in the expansion of my staff over the last couple of years. I want to say thank you to our community of veterans, as well as people across the county who show their support for those who have served our nation and for a lot of us who continue to serve our community. I also have to express a huge thanks to my staff, Michelle Baker, our information aide, and Ignacio Lopez, our first VSO. I say that because for the 6 years that I've been in here, the first half of that I did primarily solo. This year, I've had to be gone quite a few times for several sad occasions in our family. I just got back here recently from my first real vacation, and I have to say it was such an amazing thing to not be anxious or feeling overwhelmed when I come back to a huge stack of messages and complaints because we weren't here, because I have a staff here who was able to fill those concerns and keep our office running. So I have to say thank you to all of you for that support, and to them for their work here with us.
Any questions for JR? All right. JR, thank you for coming and spending some time with us and sharing. I thought we'd see a background of Rome or something instead of the snow, but that's okay.
I was trying to be appropriate here, but hey, I'll get it for you next time.
Thank you, sir. I appreciate that.
Thank you.
Next up, we got Cindy Wilcox from HSC.
Hi, everyone.
Hello.
Okay, so I will try to make this as brief and succinct as possible. Just a couple follow-ups from just some of the previous conversations we had. The new housing that's going in Route 13 by Rehabilitation Support Services, or RSS. That's actually ESHI funding, which is New York State funding. So that model, although it's been conditionally approved, that model will not be impacted by the changes at the federal level. Well, directly impacted. We don't really know what's going to happen with housing, but funding is now coming from HUD. And then as for the wait time for Section 8 vouchers, housing choice vouchers, is about 3 to 4 years, according to Ithaca Housing Authority. So, couple other updates from HSC. I'm not going to go into the gory detail of the changes at the federal level and the HUD COC projects and programs. I will direct you to Liddy's thorough presentation at the last Housing and Economic Development Committee, and also the Homeless and Housing Task Force. And that presentation, those slides, are available on the HSC website under the Housing tab. But to give you kind of a high-level summary of where we are to date, there are 2 lawsuits currently against HUD that are in process. One, there's I think there are 20 attorneys general that are suing HUD, and then the National Alliance to End Homelessness and their partners are also suing, basically for a temporary injunction related to the 2025 Notice of Funding Opportunity, or the application for HUD funds that the COC manages. The reason why they are suing them is because of the significant policy changes and basically kind of the upside downness of the application, which is very, very different, like almost a 180 from prior applications. They've also significantly shortened the timeline for the application, as well as the priorities and the whole scoring process. So the lawsuits are saying, and by the way, the Congress did approve a 2-year cycle for the funding application. That is being ignored, and the HUD is issued a 2025 Notice of Funding application, which nobody was actually expecting, or because of Congress's appropriation of funds for 2 years. So currently, the NOFO was issued by HUD. Then the lawsuits were filed, and then HUD pulled the Notice of Funding application like an hour before the judge was going to hear the case. So many COCs across the country, including Tompkins County COC, has made the decision to pause our application process. So, because we don't know what's going to happen with the NOFO, it could come back and look different. It couldn't come, we don't know when it's going to come back. There's a lot of unknowns. So although we started and initiated it, we're going to kind of pause it locally. That being said, we are still asking organizations who might be interested in applying for funds to give us like just a summary of information on what they're intending to apply for. And that's super important for us because it's so different this year. HUD is basically kind of deprioritizing supportive housing. And they're putting a 30% cap on supportive housing funding, which is significant for Tompkins County because the vast majority of our funding is for supportive housing. So we are at risk of losing like a very significant amount of money, $800,000 of our $1.5 million that we receive from HUD. So there's a lot of money at risk for us based on the new priorities of HUD. So we're just trying to get an understanding of if there are any other projects out there that maintain our values as a community, and also are eligible for this new priority area of HUD, so that we can somehow keep some of that funding and leverage it however we need to leverage it. So what the COC is doing is planning, which is what we do, right? This is really an all hands on deck moment in time. We're starting to do some contingency planning. We're bringing in the partners to kind of help do that planning, kind of figuring out what our gaps are going to be, potentially strategizing about how we may fill those gaps, getting a better understanding of the cost and the impact. So for us, Tompkins County, fortunately, the folks that are going to be most impacted are going to be the folks that are currently in supportive housing and youth, because those are our biggest areas of funding right now. So there's a lot of planning going on. The next the next legal action is scheduled for December 19th. So not sure what's going to happen after December 19th, but I'll let you know. That was probably super confusing for everybody, but that's the HUD COC update.
Any questions for Cindy? Thank you. Lady was able to share HED, so some of this we got. So it is long and very confusing, but I think you did a pretty good job. And you all are doing a very good job just trying to get us through and navigate this. It's crazy, and it's only going to get crazier. So I really appreciate y'all's efforts.
Thank you. That's kind of what we're just trying to do right now, is just keep everybody as informed as possible of all of the latest and greatest changes so we can plan.
Well, thank you, Cindy. If there's no further questions, we will move on to the next thing, which is executive session. In accordance with Article 7, Section 105 of the Public Officers Law, executive session is only appropriate for the discussion of the medical, financial, credit, or employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation. We don't expect to take any action when we come out of executive session. So I guess we'll take a brief pause to get there.
Mover in a second. Yep.
Oh, do I have a mover? Wait,
yeah,
you have a question?
Well, both. I
Okay,
can
you ask
move
your
to
question.
go into executive session.
It's 100 seconds.
Yes. We do have another meeting scheduled at 3. So how long do you expect this to take?
I hope that it will take just a few minutes.
Okay.
Yeah.
All right. But folks will have to step out and then come back. Okay. Thank you.
Yeah, it's fine.
Is there any